welcome to the EMS on AIR Podcast. The mission of this podcast is to keep healthcare providers safe, informed, and prepared. Today is May 17, 2021. This episode was recorded May 3, 2021. I'm Jeff Lassers and I'll be your host. Even though we are located in Southeast Michigan and we mention our home state a lot, today's content applies to EMS on the national and even the global scale. Every year in the United States, there are about 3,600 sudden unexpected infant deaths, or SUIDs. These deaths include infants less than 1 year old with no immediate cause. There are three most commonly reported types of SUID. The first is sudden infant death syndrome, or SIDS, which is a term we're all familiar with. About 1,600 infants died of SIDS in 2017. The second includes approximately 1,300 deaths each year from truly unknown causes. The third most common type of SUID is accidental suffocation and strangulation in bed. According to the CDC SUID Case Registry Project, every year approximately 150 sleep-related infant deaths occur in Michigan. That's about 3 deceased infants every week. Another way to think about it is 2 school buses full of kids, or 7 kindergarten classrooms gone every year due to causes that are largely preventable. The causes of these deaths typically include a person or an object in the baby's sleep space that leads to suffocation or strangulation. Common objects associated with these events include pillows, blankets, and stuffed toys. Sadly, preventable sleep-related causes are the number one contributor of infant deaths in Michigan. In Season 2, Episode 12, we introduced our audience to the Direct On Scene Education, or DOSE program, which is an innovative attempt at eliminating sleep-related infant deaths due to suffocation, strangulation, or positional asphyxia on a national scale by using first responders to proactively identify and remove hazards while delivering education on scene. First responders are trained to identify and remove hazards from an infant's sleep space while on scene during emergency and non-emergency 911 calls. Today, we welcome Dr. Sam Mishra back to the show. Sam is the EMS for Children Coordinator for the state of Michigan. Today, my buddy Sam has brought along representatives from the Michigan Department of Health and Human Services, or MDHHS, Infant Safe Sleep Program, whose mission it is to prevent sleep-related infant deaths. We're joined by Colleen Nelson, the Michigan Infant Safe Sleep Program Coordinator, as well as Patti Kelly, the Sleep Program Consultant. Part of their job is to know the incidence, occurrences, and circumstances of infant deaths in the entire state of Michigan. They are most familiar with our statewide data, so it makes sense to bring them into the fold to help guide us towards understanding the problem in our backyard. Understanding the problem and appreciating what we can do to solve it is vitally important. The State of Michigan EMS Office and the Infant Safe Sleep Program have been working very hard to bring the DOSE program here to Michigan. In this episode, our guests will help us appreciate what is at stake for newborns sleeping in unsafe situations. Then, they'll describe what the State of Michigan Infant Safe Sleep Program is doing to team up with EMS to reduce the number of preventable sleep-related infant deaths every year. As always, you can find each of our guests' email addresses and related information in the episode description, and I recommend you check out the websites doseprogram.com as well as michigan.gov/safesleep to learn more. Before we introduce our guests, I just want to say one thing. DOSE doesn't just prevent infant sleep-related deaths. It prevents parents, caregivers, and EMS providers from the experience as well. As first responders, we see and go through enough hard things, and DOSE is one of the ways to limit the number of bad experiences that we might endure. So please, if you adopt DOSE at your agency, you're not just saving babies. You might be saving your coworker, future EMS providers, and maybe even yourself from the experience of running on a sleep-related infant death by eliminating the problem before it happens. Prevention works. Let's save some babies. Please keep emailing your questions, comments, feedback, and episode ideas to the EMS On Air podcast team by email at qi@ocmca.org. Also, check out our website, emsonair.com, for the latest information, podcast episodes, and other details. Follow us on Instagram at EMS On Air, and please, whatever podcast platform you use, subscribe to our podcast and leave us a rating and a review. It really helps us to grow this thing. Thank you for listening to the EMS On Air podcast. Enjoy the episode. Good morning, ladies. How are you today?
Doing well, Jeff. Thanks.
Doing well.
I am doing great on this very dreary, rainy day. Happy to be back.
Thank you for coming on the show today. Let's start with you, Colleen. Can you tell everybody who you are, what you do, and where you do it?
My name is Colleen Nelson, and I'm the Infant Safe Sleep Program Coordinator for the Department of Health and Human Services, and also my coworker, Patti Kelly. Together, we make up the Safe Sleep Program for the Department of Health and Human Services. In that work, we work at the state level to prevent sleep-related infant deaths and disparities in those deaths.
For just two people to be involved with that, that's a giant task you got to take there. It's just the two of you?
It is. And in fact, I'm the coordinator of the program and she's the consultant and she's only half-time. So between the two of us, it's just a staff and a half.
I love that term, staff and a half. Well, Patti, why don't you tell everybody who you are, what you do, and where you do it? Is that, I guess, a half a person?
I'm the half. Yes, I'm the half. I'm the consultant for the program. So I support whatever kind of efforts Colleen and I have going on. I'm here to support the work that we do for the program. Colleen and I just kind of work together on a lot of the efforts, trying to get the best education and programming out there for families in Michigan.
I would just add that, even though we have different titles and I'm the coordinator and Patty's the consultant, really our work is seamless as far as what we do. So we have like a work plan and objectives and we divvy the work as it makes sense and take leads on different projects. So we really just work pretty seamlessly together.
Well, very good. Can you give us a little bit of your background on what makes you the right person to have in this conversation to kind of bridge EMS with the need for infant safe sleep information statewide in Michigan?
Well, my background, I actually started with the state, I think 20 some years ago now as a CPS worker. So I've always been passionate about sleep-related deaths. And when I started my career, I actually had the unfortunate circumstance where I had to investigate a few of the sleep-related infant deaths. So really saw how it impacted families. And in that, working together with the EMS professionals that were on the scene, law enforcement on the scene. So really have that firsthand knowledge of that beginning work that happens. Throughout my career, I've always done something related to safe sleep. So after I worked in the field, I was in CPS program office where we instituted a policy that child welfare staff are talking with families about safe sleep. And then I also worked in childcare licensing where there's requirements for childcare providers to follow safe sleep guidelines. And then throughout that time, I was part of the Safe Sleep Advisory Committee. So I have a lot of experience in the world of safe sleep and how it can affect multiple realms of the state. So I think that's my experience. And I've always been, like I said, passionate about it and know how important it is for families to be following the guidelines and being educated on the guidelines.
Well, you certainly sound like you have the right background to be the coordinator for this program. How about you, Patti? Can you give a little background on your expertise related to today's topic?
Sure. Similarly to Colleen, I also started out working in the field. I was a home visitor with Detroit Healthy Start in the early 90s. As a program, it's actually still continuing today. They provide home visiting services to moms who are pregnant or caring for a baby up to the age of 1. So really learned a lot about the challenges that families experience, really learned to love and became my passion working with moms and babies and really trying to help them through their first year and beyond. From there, I worked in maternal child HIV/AIDS. And then when this position came open in safe sleep, I jumped on it because I know that this is in an area where families are struggling and they're looking for help. And the more support that we can provide them, the better outcomes that we're going to have, the more babies that we're going to be able to save.
Yeah, I didn't realize this was such a big problem until we were introduced to our friends over at the DOSE program. That's the direct on-scene education program designed to, leverage the logistics of EMS. You're already in houses. If you're recognizing unsafe sleep situations, they're kind of training them to recognize those and then to speak up in a very polite, professional way and then provide resources to kind of mitigate the situation. And so I didn't realize this was such a big deal. And we got to learn about what it is on a national scale. And in Broward County, where it started, we really got to get into their numbers. And prior to you guys, I had the group in here from Oakland County Health to talk about basically the same thing, but in Oakland County. So would you guys give me an overview of appreciating what is at stake for newborns sleeping in unsafe situations?
Sure, Jeff. I think just as this is a big problem nationally, it's also a big problem for Michigan. The problem is that we don't hear about it very often. It's not on the news a lot. It's not on the radio. People don't understand how often this happens. For the last year that we have data available, which is 2018, 151 babies died in Michigan due to sleep-related causes. And that data is from the Centers for Disease Control and Prevention Suitcase Registry Project, which is based out of the Michigan Public Health Institute. That number, 151, translates to every week 3 families in Michigan are grieving a baby who died from sleep-related causes. 3 families. It's unbelievable to me, that amount of families that are going through this tragedy on a weekly basis here. If we want to look at those numbers in a different way, 151 babies a year, that's 2 full school buses of kids that we lost, or 7 kindergarten classrooms that are no longer with us because of unsafe sleep. It's really staggering. And even though I deal with these numbers every day, when I say it, it helps me remember that there's this many families that are going through this tragedy. For infants 1 to 12 months old in Michigan, sleep-related causes are the leading cause of death, and suffocation is the most frequent cause of death. So suffocation could be because of another person in the sleep space, or could be because of another object in the sleep space. Unfortunately, even though all this work that we've been doing over these many years with many professionals, we're not seeing any significant decrease in the numbers. The rate has remained fairly steady over the last 10 years, and we really want to amp up the efforts so that we can start seeing these numbers decrease, so that less babies are dying, less families are experiencing this tragedy. We know that the rates of these deaths vary a lot across the state. So from a low in some jurisdictions of 0.6 deaths per 1,000 live births, all the way up to 3.4 deaths per 1,000 live births. So there are some areas of the state that are experiencing significantly higher rates. But we also know that this can happen to any family from any socioeconomic level, in any neighborhood, in any community. So that's why the message is so important to get out to everyone. That's kind of all the sad stuff, the stuff that Colleen and I dread talking about at the beginning of every type of presentation that we do, all the babies that die. The hopeful part is that most of these deaths are preventable. The child death review teams, which review all the deaths of babies and children in Michigan, have determined that almost 90% of these deaths could have been prevented. So that's really where we have to latch on to and say, you know what, this is something that we can do. Working together with families and communities, we can make a big impact in preventing these deaths.
One of the things you brought up was the cause of death may be someone in the sleep space with the infant or an object in the sleep space. Now, can you describe the proper sleep space for an infant, and then describe how some of these unfortunate accidents occur by not really complying to those recommendations?
The ideal environment for a baby to sleep in is in a crib, bassinet, or pack and play. And then we want that environment to have nothing in it besides baby. So there should just be a tightly fitted sheet on the mattress and then baby in the crib, and baby should be placed on their back to sleep. Common issues that happen in these sleep-related deaths that we see, parents may place a blanket in the sleep environment with baby. That blanket can become a suffocation hazard when that's in baby's sleep environment. Another common one we see is where the parent may, instead of placing baby in a crib, bassinet, or pack and play, they bring baby into their bed to sleep. And this can be a situation where they don't normally do this and they're like just having a really rough night with baby and they can't get baby to sleep or settle down. So they bring baby into bed just to like feed or hold and comfort baby. And then they accidentally fall asleep in that situation. And this also commonly can happen when someone's sitting on a couch or a chair where there's like, holding baby, getting baby settled down. And then because parents are so tired, especially when they have newborns, they may not intend to fall asleep with baby, what they do. And then the parent may overlay the baby where they get an arm or something over baby so baby can't breathe, or baby gets mushed down between pillows or cushions on a couch and then is unable to breathe.
Yeah, I am actually the father of a newborn right now. She's 5.5 weeks old. And it certainly freaks us out to think about all the possibilities. And what we do is we're so mindful of the sleep environment. And it's not always easy. Like you said, you get so tired. And you certainly can appreciate those parents who've had those unfortunate mistakes of, I get it. When you're that tired, you start to make bad decisions. I mean, it's time and time again, studies will show that the lack of sleep creates poor decisions. So it doesn't make them bad people. It makes a bad decision. So sad. And like you said, preventable, which is the good stuff. So speaking of prevention, there's so many different things that we can do. We've talked to our friends at DOSE who set up a program to help provide pack and plays for people in situations that just can't afford a sleep space like that. Sometimes it's are you unknowing or are you unwilling? Some people just ignore the recommendations like that are science-based and data-driven. And then other ones are just not aware. They're so unaware of what needs to actually happen because nobody was able to tell them differently. And that's where DOSE comes in to help identify those situations and then help them provide resources. So DOSE is one example of that. But you guys over at the MDHHS Infant Safe Sleep Program are also another resource. Can you help describe what your program is doing to help limit preventable infant deaths in Michigan?
Yeah, Jeff. Well, let me start with our intent and purpose. So we work to promote infant maternal health, and that's all guided by the Maternal Infant Health and Equity Improvement Plan. And the mission of that plan is 0 preventable deaths and 0 disparities. So besides the work that we do on making sure families are educated and have that education on safe sleep and providing those concrete resources for pack and plays, like you mentioned, the DOSE program does, we also work to support protective factors that are also related to sleep-related deaths, such as making sure babies get their immunizations, that if parents are smoking cigarettes, that they can get support in quitting smoking if they want to do that. We also provide support and advocate for breastfeeding and breastfeeding supports for families. So our program, like we mentioned, is in the Department of Health and Human Services, and we are in the Division of Maternal and Infant Health. And we are just one program in that division that works to help improve families' health and babies' health and the health of infants and mothers. But we do work with other programs such as home visiting programs, immunizations, the WIC program, and others. And then we also work with other programs outside of our division, such as the DOSE program, like you said, and others across the state.
Well, it sounds like you guys are part of a much bigger system that lends itself to attacking this really big spectrum of issues that do happen, just being a human being, making other human beings. So it's always going to have situations to where it's going to need people working on it. I like that you guys have a very targeted position there where you're specifically looking at preventing infant deaths in Michigan.
One of the things that I just absolutely love that Patti and Colleen are always doing when I communicate with them. So when I first met Patti and Colleen, it was obviously about infant safe sleep, duh, right? That's what we're talking about. But it was so much bigger than that. We at the EMS office, and specifically the EMS for Children program, we were looking for a way to not just provide DOSE training, not to just provide the 1 hour of education to learn about infant safe sleep, and looking for that unsafe sleep environment in a home when we're on a call and we have an appropriate opportunity to do so. But we wanted to find a way to really have EMS have a stake in the game and participate in preventing these really horrible, tragic, and entirely preventable. When you say 90% of something bad is preventable, to me, that's a slam dunk. And we want to be part of that. So the EMS for Children program and the state EMS office, we were just so excited to collaborate. And I think one of the benefits of this Safe Sleep program is that we have a great relationship with Patti and Colleen. And like you said, a person and a half, I can't call Patti a half a person. She's wonderful. So I just think of these two ladies as amazing and passionate people. And they saw the benefit of having EMS included in this conversation. And we all had the light bulb moment at the same time. We are part of this solution. We are in families' homes. We're trusted by our communities. And honestly, we're the people who have to get there and show up and take care of these really horrible, tragic, devastating losses. They do not go away. They stick with us forever. So let us be part of this prevention so we don't have to go on these horrible calls and these babies don't have to die. So to say that they are master collaborators, I think is an understatement. And the EMS community, we're just so excited to be considered as part of the solution and invited to this conversation. And it's one of the ways that I think the EMS for Children program is helping to bridge a little bit of prevention. So we're not always just called to respond. We can help stop these from happening.
I would just add to that, the work Patti and I do is at the state level. So we are supporting all those local people that are actually out there talking to families, working in their community directly. So we do depend a lot on what actual frontline agencies and EMS providers and those are doing. So, I mean, much of our work is that collaboration piece because, we're providing the resources and the supports, but you guys are fortunately out there doing the hands-on work and really the crucial piece of this, working with families.
And I think Colleen and I, having been in those shoes, having visited homes, having sat with families after these tragedies happen, we know how difficult it is. And we want to provide as much support as possible to all of you out there who are doing this work on a daily basis and want you to know that we really appreciate all your efforts. When we talk about the numbers not decreasing, that doesn't make Colleen and I just sit down and say we're not doing anything anymore. We will keep going at this and we'll keep going at it from different angles. And our partnership with EMS for Children and DOS is just another angle, another opportunity that we can try to help provide resources so that we're not dealing with these deaths as much as we are with families.
Can we talk about some of those resources that would be applicable to EMS providers? If I'm an EMS system administrator or agency administrator, or even a provider on the road, what are some of the resources that are provided by your program that allow me to learn about what's going on or to implement strategies to limit them in my community?
Sure. I think our biggest one, Jeff, is our website. That's the place to start. So www.michigan.gov/safesleep. And on there, we try to house all the resources that are available if you're looking around to see how you might want to learn more about Safe Sleep or connect families with resources. So on there, we have things like online trainings. So on demand, anytime for free, jump on one of those trainings, get a deeper understanding of the infant safe sleep guidelines. There's a couple on there that would be really relevant and really helpful. We have a lot of educational materials too that people can access for free. You can either order them for free and they get shipped to you, or you can download them. And they're not just on safe sleep. They're also on those things that parents are struggling with things like how to soothe your baby, how to swaddle your baby, how to tell if your baby's overheated or not. So these are kind of some of those supplemental materials that you can provide to families that will help them kind of work through these challenges that they're trying to navigate with a newborn. Videos are on there as well. Things that you can either look at yourself or show families, parent testimonials, things that really hit home with families to tell them how a death like this can happen and the tragedy that really can occur. One of the best ways to stay in touch with all the resources that we have and to be updated is to join our Listserv. And I know people don't like to sign up for more emails, but we don't bombard you. Maybe once a week or once every 2 weeks, you'll get an email that might tell you about a new resource we developed or a training opportunity or some work from some of our partners. Really a good way to kind of keep your finger on the pulse of what's going on with Safe Sleep. And you can sign up for that right on the website. It's really easy. I really encourage that. That's really the best way to stay in touch with what's going on in the Safe Sleep world.
Yeah, Patti, I was going to say that Listserv has been really helpful too for the EMS for Children program so that we can continue to share the messages that you guys put out. I've had a lot of appreciation from some of our pediatric champions because I share with them these opportunities in case maybe they haven't heard about it before or they haven't signed up for the Listserv. And I've even had them ask me, can I sign up for that too? And I said, absolutely. But that's another way that we want to try to support the message. And honestly, we want to be consistent too. So the Michigan EMS world, we want to jump on board, but we want to make sure we're sharing accurate information, concise guidelines, and really following through. And you and Colleen have been instrumental in making sure we share the most accurate, updated information with our providers and our leaders. And so that's somewhere I turn to very frequently. In fact, I think it was like 2 weeks ago, Terry Godey ordered some materials and she shared with us how quickly they showed up. And she was so excited because you didn't hear it here, but not everything at the state level happens fast. So the fact that we got quick delivery of pamphlets and materials because she needed them for some training classes, that's awesome. We can get what we need. And we're really grateful for all the resources you guys put out.
Oh, that's great to hear. We're glad that you found that all useful and helpful. That's what we're here for.
I would just add too for the website, check it out. There's a lot of information on there, but we're continually updating it and adding information. So, a lot of the resources that we've developed has been because we've done trainings for people and they're like, I could really use a resource on this, or we always get questions on this. And then so Patti and I go back and we're like, well, maybe we could make a resource on that. So a couple years ago, we did a series of trainings for hospitals across the state. And out of that, we developed a new resource on overheating and how to make sure your baby doesn't get too warm during sleep, and then one on how to properly swaddle your baby. So the resources we have really have come directly from people working with families and what they've told us they needed. Again, that one Patti talked about, the soothing a crying baby. When people are following the safe sleep guidelines, sometimes it does make their baby sleep less well. And that's why it's protective for sleep-related death. But then it's also like, well, give me some tools on how I can actually settle my baby down and make sure I'm doing those pieces of it. So try not to make it more difficult for families.
Right on. So if I'm an EMS provider trying to identify, is this even a problem in my backyard? I totally trust you that this is a huge problem, but not every city, township, village has the same number of babies, right? So the more babies you have in a geographic service area, the higher risk you probably have. So how can I, as an EMS system or agency, identify the current status of this problem in my backyard?
If you go to our website, the michigan.gov/safe sleep, right on that main page, there's a blue bar that says get the facts. And under there, there's a couple links to some data sources. And one is the data on sleep-related infant deaths in Michigan. And that'll take you to the SUID Case Registry Project's website. There's a report that lists all the communities in the state, and you can see their data. There's also some fact sheets on the website for certain communities that may have a higher rate than the state of Michigan, or ones that have a lower rate than the state of Michigan. So if there's a significant difference in a community's rate than the state as a whole, they'll have a fact sheet on that website as well. But you can start with our website and get linked over to theirs.
Yeah, that sounds great because, just because I don't go on that call, I might be what we call a white cloud, where I just don't get those bad calls. But what if I'm the black cloud and I've only been on a couple of years and I've been on a bunch of these calls? You got to know what the data says. So I think that's fantastic that you guys have been purveyors of that information to let me know what the problems are, where I am, where I can implement solutions.
Newly added to our website is a button, Infant Safe Sleep Resources by County. Anybody in the state can go to that link on the page and look for their county, and they can kind of see who's doing safe sleep work in their county. So it may be the local health department, it may be another community-based agency. So they can see who might be doing training for families or education for families, where they might be able to get a pack and play for someone in their community if they aren't able to obtain one through DOS or some other avenue, and they can start there. And if they're still having trouble, they can certainly always contact Patti and I. We're always, willing to help or connect them to somebody that we might know in their local community that we know is doing the safe sleep work.
Thank you, Colleen. I use your website all the time and point them to that link. That might be one of my favorite ones because you can hover right over the county. And like you said, you can click and each one might have a little different resource. So some of the counties even have sleep sacks that might be available to the family. And then by being able to circle back and provide them the local support, not only from us at the state level with you guys in the EMS for Children program, to get down to the local level, you'll have resources that might fit your community a bit better as well, because that's what they're looking for. So one of the things that we can help with too with the EMS for Children program is we're always going to be making sure to have more DOS training opportunities coming up. And that would also include train the trainer opportunities. We've had our first multi-agency DOS train the trainer event about a week ago, and it was very successful. We had 11 agencies represented. And I'm actually personally working with each attendee from the Train the Trainer event to connect them to their local resources. And that's actually the tool that I'll be using. And like you guys know, sometimes I call you or email you and say, hey, do you have any personal connections in this community? Because we have some interesting ideas that are targeted outreach for community needs. So if anyone is looking for those local resources and just feels like maybe they would like a little help with that connection, you can always reach out to me. And Jeff always has my info, so you know how to find me.
So you guys work on public awareness, you do professional training, you do public training, and you're supporting local efforts. You're helping us out with implementing DOSE into Michigan and a few other things. Is there any other local efforts you're working on?
Yeah, one of the major programs that we have is to provide funding to areas that are experiencing higher numbers, sleep-related infant deaths. And so we provide grants to 5 local health departments and the Intertribal Council of Michigan. And the 5 local health departments are the City of Detroit, the counties of Wayne, Oakland, Kent, and Genesee. Those counties comprise about half of the sleep-related infant deaths in Michigan each year. So that's why we're funneling the money there. We don't only work with agencies that we fund. We were involved with a lot of different agencies, as Samantha said, and a lot of different groups of providers. So in terms of local efforts, for example, up north, there's a network of baby pantries, and they provide a lot of concrete support to families like pack and plays and diapers and things like that, as well as education. And they contacted us to say, hey, we want to do more around safe sleep. And so we trained their baby pantry network volunteers and providers so that the information could get out on that level as well. So really, as Colleen and I kind of say, we will do anything around safe sleep for anybody, any group that approaches us. We'll figure out how to work with you. How can we support you? Another example, we're working on a project with the Michigan Public Health Institutes to support child welfare staff. So that frontline child protective service worker who goes into the home, how can we support them in connecting families with resources? Another area that we're focusing on in particular this year, and this came out of the data, we learned that young parents are struggling with this for a lot of different reasons. It's difficult to be a parent as a young person, number one. And then when the baby actually arrives and you're having to care for the baby and there's not a lot of supports for you, it can be really challenging. And we learned that infants who had mothers who were 19 years old or younger had almost twice the rate of sleep-related infant death than mothers aged 25 to 29. So that just really a light bulb went off for Colleen and I saying we need to do more for young parents. And so fortunately, some funding arrived at just the right time. And we're now instituting 3 new projects to provide that hands-on support to young dads and young moms to help them navigate this new role as a parent and help provide them the education and the support and the mentorship that they need to be able to get through this and to be able to really thrive as a parent and to keep their infants safe. So I give that as an example just to say we follow the data, we follow any requests that we get from people saying, hey, I want to work on this, we'll jump on it. And we will really get behind any requests that people bring to us around wanting more assistance with safe sleep.
I think we touched on this earlier in the episode, but I just wanted to reiterate too that we know caring for a baby is really hard. And, we've talked a lot about how these deaths are preventable and we're focusing on that. But we also want people to know that just because something's preventable doesn't mean it's easy to do. So there are challenges with following the safe sleep guidelines beyond whether the family has the education or access to a pack and play. So I think if you're out with a family and you see that they might be struggling, getting them hooked up with additional resources, such as maybe they could benefit from some home visiting services, or they could benefit from being hooked up with a community-based agency. So I think it's really helpful as much as possible being aware of what's available in your community so you can support families beyond just that initial quick visit that you might be in the home, but then getting them supported so that they can go on and have the supports that they need for their family.
That's how everything works in Michigan. And I'm guessing you guys work either with neighboring states or similar states that have either similar problems or conditions as we do. So can you talk about any collaborating and supporting U.S. states that you're working with and any cool projects?
So we don't have any formal collaborations with other states, but we've had other states reach out to us. Recently, the state of Texas emailed me. We had a webinar that was on our website and they were looking for the slides and the recording for it so they could share that with their providers. We've had other states contact us about some of the other trainings that we have available, wanting to basically use the content in our training to put in theirs because no need to reinvent the wheel if there's good training materials available. We did recently meet with the state of Ohio's WIC program, and that was facilitated by our Michigan WIC coordinator. And they really wanted to know how we kind of had developed our relationship with WIC in working together on supporting breastfeeding and safe sleep. In the past, there's kind of been a little bit of a struggle of promoting both safe sleep and breastfeeding.
Can you give a background to what WIC is?
WIC is the Women, Infant, and Children program, and they provide food supports for families, and they also provide breastfeeding support for breastfeeding moms. So they have breastfeeding peer counselors that can work with moms on making sure that they can breastfeed their baby and address any issues that they might have.
Well, thank you. I think that's really cool that all the states really share. It seems like it's the same thing everywhere we go, right? EMS agencies, we share lesson plans for education and training. We share all sorts of things. Hey, what tools did you buy for EKG monitor? Why did you get that? We share that information all the time. So it's really up the chain everywhere we look. We're really doing that. So it's good that there's these open lines of communication and resources and everybody's sharing. So Patti and Colleen, any closing thoughts?
I would just say thank you for having us on. We always want to promote what we're doing and making sure that families are getting access to the education and to a safe sleep environment where possible. And I think, as we've said throughout this, we are always more than willing to help you do whatever it is that you need to do or what you're wanting to have accomplished in your agency. So if you want training or if you need access to something, certainly feel free to reach out to us and we will either help you out personally or get you hooked up with the right person that can help you. And we're always available to help in any way possible.
And if you're not a Michigan resident or working in Michigan, you can get a hold of Patti and Colleen in your state. So where do I find those people if I'm like in Utah or Missouri, Mississippi? Is there somewhere I can look for this information, or do I just Google my state and infant safe sleep program?
That would probably be a good way to tackle it. A lot of times they're located in the state health department, and they're probably somewhere in whatever your state calls the Division of Maternal Infant Health. There's probably a safe sleep position there, a safe sleep office there. So that might be a good way to do it.
It's a good old Googler.
Yeah.
Dr. Mishra, what else you got? Any closing thoughts for us?
Yeah, thanks. So a couple things popped into my head just now. So we're talking about sharing, and I think that's super important with this because literally we wouldn't be having this conversation if I hadn't met Patti and Colleen. So even though Google isn't always the best, sometimes it's helpful, right? So if you want to check out other programs or you have ideas, we always want to hear from you about things that you think would be beneficial. And I just wanted to point out, DOSE, it did come from Florida, right? And we're using it. Michigan is one of the biggest adopters of this philosophy, and it's being used in many, many states across our country. And in fact, we have interest, outside of the United States because this isn't unique just to us. So we are part of talking about this very difficult, very uncomfortable situation where babies are dying, but we can help stop them. So if you have ideas, I'd love to hear from you about ways you think you can be engaged in your community. And all of us here on this episode are super involved and ready to support you with that too. So if you have an idea of what you think would work in your community or something you think we're missing, we want to hear about it so we can incorporate that into our plans. You also shared a couple of points about working with other states on education and training. So some other states even have community paramedicine programs that focus on maternal and infant health. And while we don't have that as an official pathway in Michigan yet, I can let you know that in the state EMS office, that's something that we're talking about pretty consistently. We'd really love to incorporate some of these training components for our providers too. So we're learning from things like Project Swaddle, which is a really cool thing you can check out. There's a lot of things that we can do. So our ears are open and we're here to support you.
Well, as always, Dr. Mishra, you're awesome. And thank you, Patti and Colleen, for coming on. We hope to have you back and keep up the good work.
Thank you.
Thank you.
Thanks, Jeff.
That is all for the show today, everyone. Thank you for listening. And thank you to Sam, Colleen, and Patti for coming on the show. I really enjoyed our conversation, and I hope that this episode drives awareness and preparedness for situations that include infants and potentially unsafe sleeping situations. Again, to learn more about how you can implement DOSE or obtain more information, go to their website, doseprogram.com. Also, check out the website michigan.gov/safesleep if you are an EMS provider in Michigan. We'll see you next time. Until then, please keep emailing your questions, comments, feedback, and episode ideas to the EMS On Air podcast team by email at qi@ocmca.org. Check out our website, emsonair.com, for the latest information, podcast episodes, and other details. And please, whatever podcast platform you use, subscribe to the podcast and leave us a rating and a review. Thank you for listening to the EMS On Air podcast. Stay safe and have a great day.